Ever wondered why some women face irregular periods, acne, or weight gain? Could it be PCOS or PCOD? Is it that mysterious acronym that keeps popping up in health discussions and women's magazines? Or maybe it's that thing your friend mentioned the other day? Well, you've come to the right place. We're going to delve into the world of these two conditions, exploring their differences, their symptoms, and even how nutrition can play a role in their treatment. Well, today we're going to unravel the mystery behind PCOS and PCOD. Let's start by understanding what these acronyms mean. PCOS stands for polycystic ovary syndrome and PCOD stands for polycystic ovary disease. Now you might be thinking, those sound pretty similar, and you're not wrong. But the devil, as they say, is in the details. Polycystic ovary syndrome, or PCOS, is a hormonal disorder common among women of reproductive age. Women with PCOS may have infrequent or prolonged menstrual periods or excess male hormone levels. The ovaries may develop numerous small collections of fluid or follicles and fail to regularly release eggs. On the other hand, polycystic ovary disease, or PCOD, is a condition where the ovaries produce a large number of small cysts. These cysts lead to hormonal imbalances causing issues like irregular periods, unwanted hair growth, and acne. While they might sound similar, PCOS and PCOD are actually different in several ways. Now that we know what they are, let's dive into how they differ. Polycystic ovary syndrome, or PCOS, and polycystic ovary disease, known as PCOD, might sound similar, but they have distinct characteristics that set them apart. Let's start by looking at the causes. PCOS is largely considered a genetic disorder, with insulin resistance playing a significant role. On the other hand, PCOD is usually triggered by an unhealthy lifestyle or hormonal imbalance. When it comes to symptoms, both conditions can present with irregular periods, but there are some key differences. Women with PCOS often experience more severe symptoms, such as excessive hair growth, acne, and weight gain. Those with PCOD, however, may notice weight gain and irregular periods, but typically don't have the high levels of male hormones that lead to symptoms like excessive hair growth. Now, let's talk about the effects on the body. Both PCOS and PCOD can lead to the development of multiple small cysts in the ovaries, hence the similar names. However, the cysts in PCOS are usually larger and may cause more discomfort. Furthermore, PCOS has been linked to a higher risk of developing health issues like diabetes, heart disease, and endometrial cancer, while the long-term health risks associated with PCOD are currently less well-defined. Despite these differences, it's important to note that both conditions can potentially impact fertility. Women with PCOS may have difficulty ovulating regularly, while those with PCOD may experience irregular menstrual cycles, both of which can make conception challenging. As we've seen, while PCOS and PCOD share some similarities, they differ in causes, symptoms, and effects on the body. These differences underline the importance of accurate diagnosis, as the management and treatment strategies for each condition can vary significantly. It's clear that while PCOS and PCOD share some similarities, they are unique in their own ways. Remember, knowledge is power. Understanding the differences between these two conditions can empower you to seek the right help and treatment. Stay tuned as we delve deeper into the symptoms and nutritional treatments for PCOS and PCOD in our next scenes. But how do these conditions present themselves? What symptoms should one look out for? Let's dive into the common symptoms of polycystic ovary syndrome, PCOS, and polycystic ovarian disease, PCOD. The unnerving thing about these conditions is that they often lurk silently. They're like unwelcome guests who don't ring the doorbell but just slip in unannounced. That's why awareness of the symptoms is crucial. Now, the first sign you might notice is menstrual irregularities. This could mean your periods are more painful than usual, or they might come at unpredictable intervals. Some women might even experience periods that are heavier than normal, while others may not have them at all. It's like your menstrual cycle has taken a roller coaster ride without your permission. Next, let's discuss hormonal imbalances. This is like a puppet show gone wrong, where the puppet strings are your hormones, and they are not dancing to the tune you'd like. This imbalance often manifests as increased levels of male hormones known as androgens, which might lead to physical changes. You might notice increased body or facial hair, or perhaps your skin might become oilier and more prone to acne. Then there's weight gain, especially around the waist. It's like your body decides to redistribute your weight in ways you didn't sign up for. This isn't the kind of transformation most people hope for, and it can be quite distressing. Lastly, there could be signs of infertility or difficulty in conceiving. This is because PCOS and PCOD can interfere with ovulation, making it a bit like a game of hide and seek where the egg doesn't want to be found. However, remember, these symptoms can vary greatly from person to person. Not everyone will experience all of them, and their severity can differ too. It's like each person gets a unique mix of these symptoms, a cocktail no one asked for. Knowing these symptoms can help in early detection and treatment. So keep an eye out for these signs and consult a healthcare professional if you notice any of them. After all, knowledge is power, and understanding our bodies is the first step towards taking control of our health. So, you may be wondering, can nutrition play a role in managing these conditions? The answer is a resounding yes. Nutrition plays a pivotal role in managing both polycystic ovary syndrome and polycystic ovarian disease. A balanced diet is key. It can help manage symptoms, improve your overall health, and increase your chances of conceiving if you're looking to start a family. But what does a balanced diet look like? It's about consuming a variety of foods that provide the nutrients your body needs. This includes whole grains, lean proteins, fruits, vegetables, and healthy fats. Now let's delve into specifics. For individuals with PCOS or PCOD, incorporating foods low in glycemic index can be beneficial. These foods release glucose slowly into your bloodstream, preventing a spike in insulin levels, which is often associated with these conditions. Foods like brown rice, whole wheat bread, and most fruits fit this category. Avoid foods that can cause inflammation, such as processed foods, sugary drinks, and excessive caffeine. They can exacerbate symptoms of PCOS and PCOD, making it harder to manage these conditions. What about supplements? Certain supplements can be beneficial. Inositol, for instance, has been shown to improve insulin resistance, a common issue in PCOS and PCOD. Omega-3 fatty acids, found in fish oil, can help reduce inflammation and improve cholesterol levels. And don't forget about vitamin D, which is vital for bone health and has been found to be deficient in many women with these conditions. Remember, while these dietary changes can be beneficial, they should not replace medical treatment. Always consult your healthcare provider before starting any new diet or supplement regimen. But let's not forget about the power of hydration. Drinking adequate water is essential for flushing out toxins and maintaining a healthy metabolism. Aim for at least 8 glasses a day. So does nutrition matter when it comes to managing PCOS and PCOD? Absolutely. It's not just about what you eat, but how you eat. Small, frequent meals can help maintain stable blood sugar levels. Indeed, nutrition is a powerful tool in managing PCOS and PCOD. It's about making smart choices that not only nourish your body, but also help manage your symptoms. So, take charge of your health today, one meal at a time. So, we've covered a lot today, haven't we? From understanding the definitions of PCOS and PCOD, to distinguishing their differences and recognizing their symptoms, we've journeyed deep into these often misunderstood conditions. We've also explored how nutrition can play a pivotal role in managing these conditions, emphasizing the power of a balanced diet and lifestyle. Our exploration into PCOS and PCOD has shown us the complexities of these conditions. We've seen how they're similar, yet distinct, and how their symptoms can impact daily life. But most importantly, we've learned that these conditions are manageable, and that the right nutrition can make a significant difference. We hope that this knowledge empowers you, or someone you know, to navigate these conditions with confidence. It's important for us to keep these conversations going, to keep learning, and to keep sharing our knowledge. So let's take what we've learned today and spread the word. Share this video with your friends, your family, your colleagues. You never know who might benefit from this information. Maybe it's someone close to you, or maybe it's a stranger halfway across the world. We've only scratched the surface of this topic, and there's still so much more to learn. So, stay tuned for more informative and engaging videos from us. Remember, knowledge is power. The more we understand about conditions like PCOS and PCOD, the better we can manage them. Thank you for joining us today, and we look forward to seeing you in our next video.